I'm going to show this patient's result today. This is a patient, he came in for some TCA Cross and some Bellafill today, and I had worked on his skin way back in May of this year, so it's about 6 months out. You can see this improvement over here for his scars over the course of these last 6 months. We're going to continue to do a little bit more with some TCA Cross and some Bellafill for him, but I just wanted to kind of showcase this as more of like this progress report. And as we're kind of chipping away at this, this is a common skin type that I work with a lot. This is a patient who is East Asian descent, and there's a way I do it. And I'll try to walk you through just the different steps that I took to improve this patient's skin quality and overall just the appearance of his scars. So I'll wait for a few more moments for everybody to kind of check in right here, as we're on multiple different platforms. But for those just joining, I am Dr. Qazi. I am a skin restoration specialist in Newport Beach, California. And I do a lot with acne, with scars, with pigmentation, also a lot with facial balancing. And all that was actually involved with this particular patient. I'll kind of showcase a little bit about what I will still do for him and kind of what I would expect for his kind of scars. In just a moment, what I'm going to do is actually I'm going to blow this up a little bit larger so you can see just that before photo here. And we'll kind of walk through just the process for these kind of scars. You know, a lot of people ask for results from like more subtle scars. And so I think this is a really nice process. So this patient, basically what we did was we first did, if you look at these kind of scars right over here, he has a few different types. So he has tiny little ice pick scars. With those, what we do is we do something called TCA Cross. So that's where I place a little bit of an acid at the base of the scars. And we ended up doing that really for most of those cheek scars, also even some of his temple scars, which you can't quite appreciate in this photo, but we definitely did that for those. And then we also did something called subcision, and I broke up the scar tissue. You can actually kind of see it right over here where there's this indentation in the mid-cheek pad. You'll see that there's like this flattening effect in the center there. Pretty soon I'll be able to draw in here and you can kind of show it to you a little bit better, some of these things. But for now, hopefully it's clear for you where you're looking at this with that lighting. You'll see where there's that indentation there in the central part of the cheek. So he has not only this area, this aspect where it's tethered or stuck, but he also had some volume loss over here. So he had volume destruction, so fat loss. So I had to address that as well. So the ways we did this was we did TCA Cross, we did subcision, and then if you notice, you also could see that he has some textural issues. So you could take a look and see that there's this area where there's these raised parts of these scars. So if you look at like the deep part of the scar and then around the scar tissue, there's these raised areas there. And those we actually want to go and individually smooth those down. So I used what's called an ablative CO2 laser. So it's fully ablative CO2. And I was really tracing those thick scar edges. And that's what I ended up doing for that portion of things. And then I also created these little micro channels in the skin and put some laser assisted scar complex, which in this case for this patient was mostly with a very dilute form of Sculptra. And then we continued to improve his skin quality that way too. So someone's asking how many sessions. So basically we did this the first session, and then he had him come back and I did some Bellafill for the patient and then a little bit of TCA Cross. And now today when he came in, this is before we ended up doing any treatments though, but today when he came in, we did the TCA Cross and we did a little bit more Bellafill for him. So, I'll expect it to get even better. And then probably in about 2 months or so, 2 or 3 months more, I'm waiting for the skin to heal a little bit more, and then I'm going to do another laser. So it's not all about laser. It's really about a few different things, especially more like TCA Cross. And then it's also with that subcision to actually break up the scar tissue. And then it's also involving the it's also involving the lasers and really like select areas is how we do it. I actually essentially just really focused on just some of the thick areas. I don't really use the high energy heat all throughout the whole face. I really blend it in. I'm a big believer in blending in. So for someone like this who's East Asian origin, we have to be very, very careful with the skin types. And so we're looking at this and, you could see for this patient, he already had a little bit of redness when he came to me, and actually there's less redness now. now. I noticed that actually a lot of times East Asian patients tend to have something called post-inflammatory erythema more commonly than other ethnicities. So these little red marks are a little bit more common, more frequent with East Asian patients. And so I'm very, very aware of that. And there's ways that we could do this. In this patient, he follows along all the instructions that I give. And, over the course of about 2 months, his redness improved. And you can see really, really beautiful improvement now when he came in today. So really happy with him. He's really, really happy. We're going to keep on chipping away at it. This is more like this in the middle kind of progress report 6 months into this. You can see kind of what to expect, really, if you follow along the instructions. He's a non-smoker. Diet is otherwise good, otherwise a fit patient. So you can see, a really, really nice improvement in clearance of those scars. Where in California are we located? We're in Newport Beach, California, just a few minutes away from John Wayne Airport. Let's see here. Puna saying, what laser is good for melasma besides Pico? So you could do the Q-switch, it may be okay, but I find the Pico is the best because the Q-switch laser sometimes has more rebound pigmentation, so I don't love it as much as the Pico laser. Ethan saying, my work is amazing. Appreciate you, Ethan. Could you do this with someone with trigeminal neuralgia? Yes, you can. Yeah, there's no problem. I would have no problem with that. But yes, this is, I had a bunch of people last week were asking for more like subtle scars. So here you can see that progress, that improvement with more like these subtle scars. Not everybody has the very, very deep, thick scars. A lot of patients, actually, this is, the bulk of our patients who has this. And so you can see 6 months out, that improvement over here. This patient, he did have a few different things that, helped out with him. He had... one, his age is helpful. And then on top of it, very, very good lifestyle, eats well. Like I said, very, very good with sun exposure too. So a few different things that really ended up helping out with him. So I do think that it's really nice to kind of see this progress over 6 months here. Hi, Gabe. How's it going? Let's see here. Gabe is asking, does an erbium laser work for pigmentation? Not so much for melasma. So the question before was with melasma. I would not recommend erbium laser for melasma. It could help for a little bit of the superficial pigmentation, sometimes like sunspots. It could definitely do that, but it wouldn't help so much with melasma. In fact, it could make it worse, actually. So I would not do that. Valentina is asking, do we do dermabrasion? Yes, absolutely I do. You see most of my patients, though, are Fitzpatrick 4 and above. I typically don't push something like dermabrasion on patients with Fitzpatrick 4 and above unless I do other different tools, and I'm really making sure that I'm very, very careful with the pigmentation issues that could occur. It's not so much the hyperpigmentation that I'm concerned with, but sometimes you get hypopigmentation with dermabrasion, but there's ways to do it so you can do it safely. So yes, we could do that, absolutely. And for those just joining, I'm going to showcase this again. I'm Dr. Qazi. I'm a Newport Beach I'm located in Newport Beach. I got that tongue twister. I'm in Newport Beach, and I am a skin restoration specialist. And in this case, what we're doing is we're showcasing the scar results over here. So you can take a look and see this patient with the kind of scars he has, ice pick scars, rolling scars. He had actually even some boxcar scars as well. And we had to do a few different things really to help out for this patient. A beautiful result. Originally he wasn't actually letting us share the results, but today he was super happy, super, super happy. And he's like letting us share it here at this point. 6 months out of this, he's like very, very happy now that there's significant improvement. And it's this marathon, I always want to tell people it's a really, really sometimes slow for some certain kinds of scars, but ultimately we could get there. So this patient at this point, this was 2 sessions, different things though. First session was where I did subcision, I did TCA Cross, I did as well as laser. I did ablative laser. I did fully ablative CO2 laser, fractionated CO2 laser, and through the laser channel holes, I put dilute form of Sculptra there. And then I also did some Bellafill in the second session and TCA Cross. And so there we had that. Do I do punch excision? Yeah, I had a patient today, multiple punch excisions for that patient today. I think we'll have a video soon for that one. But multiple today. So I do a lot of that actually. It depends on how deep the scar is, how thick it is, and overall where the scar is located. Let's see here. Bao Kimmy saying, hi Bao Kimmy, by the way, good seeing you on. just getting on here, how many sessions? So this was basically one combination session, and then we did an additional session for some Bellafill, and then also we did a little bit more TCA Cross, and then he came in again today, and we did a little bit more Bellafill and TCA Cross. So I'm sure in a few months we'll be able to see a really some more improvement over here for his scars, and he's going to do some more laser as well. Let's see here. Lily's saying, is punch excision for ice pick scars? Yes, and you could even do it for some boxcar scars as well. Samaraj is saying, can you help me perform my VP punch biopsy? Also, can you do punch biopsy if there's a couple spots on the area? I'm curious what you're asking exactly. You're asking for verteporfin, punch biopsy, and if there's a couple spots, I'm confused what your question is. Are you saying you're doing it somewhere else? You want me to do it? I am still waiting for my waiver. I hope with the new changes to the FDA, we'll be able to get a waiver soon. Hopefully, well, but it hasn't happened yet. I'm waiting for the FDA waiver though for people to do verteporfin on patients. Let's see here. Jay Dre saying, this looks really good. What treatments were used here? So this was subcision, this was TCA Cross, this was ablative CO2 laser, and then we also did fractionated CO2 laser, and then through the laser channel holes to put dilute form of Sculptra, and also place some Bellafill. Cutie Patootie is saying, can Bellafill migrate? Good question, actually. Really good question. The Bellafill, really, I have multiple. I've done it for 7 years. I have it in my own face. And there's a way to do it. There's a way to layer it. And so it looks beautiful the way I do it. And it doesn't migrate. I could showcase that because I have ultrasound. I have patients that I have to do ultrasounds for other things. The Bellafill is exactly where I expect it to be. And I don't run into any problems with it. And on top of it, my partner is a plastic surgeon, and she does facelifts on patients I do Bellafill on, and she has no problems or any issues whatsoever with any of the Bellafill that we put in there. And so it's something I'm very, very comfortable with. There's a way to do it, and it just depends on your practitioner, honestly. That's what matters there for Bellafill. Let's see here. Samaraj is saying, I'm conducting a trial for verteporfin. However, I don't trust my doctor fully. So if you're not, sorry, I don't mean to laugh, but if you're not trusting your physician for something like a biopsy and for an experimental drug, you probably shouldn't do it like that, honestly. And to be totally frank and honest with you, I like it. I think it's nice to try. I think it's a good thing to do. But really, it's something that that I'm doing it. There's a reason why I'm trying to get it where I have where I'm making sure that I get an FDA waiver for it. But you're talking about your face. You're talking about doing an experimental drug on your face. And also, if you exclude the experimental drug, you're talking about doing an excision anyways on your face with somebody you don't trust. Don't do that. Just don't do it. It's your face. Whatever your scars are, whatever's going on, whatever you feel like you're doing it, just consider not doing that. Try doing something else, or just live with them for a little while. Maybe just get a little bit of filler in there for now or something like that, and until we sort of sort out of what other options there for you. But if you're not trusting your physician to do these, treatments on you, don't do them. These are invasive treatments, and I think it's fair to kind of, be careful with everybody that you're doing things with. But at the same time, I gotta say that there's not that many people that do this stuff. I kind of emphasize that a lot. There's just not, and you kind of have to really do your own homework and seeing if this is somebody you really trust. I think that there's only a few people I myself would trust. Hardly anybody, but to be honest with you, hardly anybody. But if you found someone that you could trust, then go for it. But there's very few things that I would trust with this stuff. And I'm in this world, and I see people's hands, I see the way people do it. And before I even got into this world, I saw myself also as a patient sometimes what people were doing and things like that. And so you could ask me to sometimes, I'll tell you, but really go with your gut. If you feel like this guy's not comfortable enough doing punch excisions or doing the treatments that he's doing, and really everybody who's not comfortable with stuff should just tell you if they just can't do certain things, that they don't treat scars. I think it's good that they'd say, I don't treat these scars. And some people just tell everybody that they do everything, and then they get messed up badly. Patients get messed up. There's somebody that's out of state, and they're messing up a lot of patients with excisions all the time, and I deal with them all the time. And they're doing it. I'll say it's someone in Texas, and so many patients that I've had, actually that, and also in Vegas area too. And it's like interesting, it's like there, and it's not just like one time. It's not like one time, maybe it's like it happens, but like it's over and over and over again that I'm dealing with some of these cases where it's like, man, dude, like that was on a good spot to be excising, and the way you excised it was like, problematic. And they're going to, plastic surgeons for this stuff. But sometimes it's like they're not like specialists in scars. They may be really good for a breast aug, but like they're not like the person that you should go to for scars. If that makes sense. It's like some people are really good at what they're doing, but they're not necessarily the best at like these things. What are revision cases? Sorry, so revision cases meaning like if somebody did some scar work before and then we have to fix it. Sometimes, a lot of times, it's not like complete, and so you have to go back and fix it. Is there a laser treatment for eye bags? Well, not quite laser treatment. There's things that we could do to tighten it, though. Definitely, there's things like CO2 laser, erbium laser, Morpheus 8. All those things can help tighten it, but it just depends on how you do it. But true eye bags, like true fat herniation, really what you need to do with that is going to be more with surgery. Really, there's not really much you could do with that other than surgery. Just, honestly, that's the truth of that. It's not going to be like a quick fix, something that you just kind of do and like you just sort of like hope for the best with a laser. I'll tell you honestly, clearly, if I think that the laser is going to be enough, I do enough of it, I know where you're going to get optimal results. But some people do want like just something, and it's okay. We'll be able to help you with that. I just want to be clear that like it depends. If it's really, really severe eye bags and fat herniation, like the fat pads are bulging out, you just need surgery. And it's better to do that. Hi, Joey. How's it going? Hope you're doing well. Just see, Joy is saying, what do you think of sublative RF for boxcar scars? I have never really seen great results like that. I think it may help a little bit, but I've never seen great results with that. User 24 saying, I know pico laser is ideal for discoloration, but would CO2 erbium help at all? Depends. What's your skin type? What is that? One pocket is full saying, why is a person keloid on neck? What's the science behind this? If there's any, usually it's due to friction. Usually there's some sort of friction in that area. So, if you're rubbing from even shaving, for example, that could potentially happen. I do see it more commonly with patients who use an electric razor, for example. I actually caution a lot of men with acne not to use electric razors, especially around like angled areas. I tend to see a lot more with keloids or just hypertrophic scars with patients who use electric razors. So that's something to pay attention to as well. User 24 is saying that they're considering doing CO2 laser, erbium laser for pigmentation, and their East Asian descent, potentially Fitzpatrick 4. I would not recommend it for your skin type. The reason why I was asking if you are more like Caucasian, Northern European, I could consider doing it. Even Mediterranean skin type, I may not do it as much. Native skin type, I may not do that as much. But with pigmentation, I would usually prefer probably the pico laser for darker skin types, patients with more melanin deep inside the skin. I have a lot of patients who are Korean descent, and they appear very, very pale. A lot of times it's very, very good with sunblock. But if you use excess heat with lasers, they will pigment really quite a bit. They'll get hyperpigmented. This particular patient, he could have pigmented very, very easily as well. There's ways to do this so we can mitigate that, prevent that. But it's something that I pay attention to all the time because it's like skin type really does matter. Not so much what color your skin is. I've a lot of times actually I put this stuff out there on my on these videos, and people will get some pushback and saying, this guy's dark, this guy's so white, he's not dark, and something like that. And it's like, it's not about like the person's skin type, it's about how they're tanning, and if they tan, if they're sunburning, if they get sunburned. Those are things that matter. Actually, that's what actually we have to pay attention to. It's not about like what the color of their skin is, because the color of the skin actually may not be accurate, because some people don't have much color in their skin, but they do get a lot of pigmentation. Sure, it could help a little bit, but it's not really the end all be all for patients. Substance Abuse 69, I really hope that's not the real name there. If the top layer of skin is destroyed due to scarring, how can one get that back? Subcision, filler. Well, if the top layer is destroyed, usually with something similar to what we did for this patient, where we did more localized laser for that, and then we ended up blending it in with other lasers. So it depends on what you mean by destroyed. Emily Wang is saying, what's the difference between invasive and non-invasive laser? I don't say invasive or non-invasive. What I say is actually, I say ablative or I say fully ablative or fractional ablative. That's what I tend to use. There are non-ablative energy devices as well, but the ones I use for scars are fully ablative or fractional ablative. The difference is that fully ablative means that really there's no gap with the skin. There's complete charred skin. So essentially, you may notice sometimes when we do these videos, you'll see that there's these areas where it looks like there's these white spots that are on the skin. That's ablative tissue. There's a little bit of in between those areas, there's a little bit of healthy tissue there, so that overall the skin quality gets a little bit better and faster healing recovery time. But if we do fully ablative, it's really crispy. It's just like charred. And we do that more, especially for the way I do it for more localized areas. So I don't do it like the full face. I really just try to make sure that it's just smaller areas that I do fully ablative. And it's a higher risk procedure, but that's why I used angle lighting. Shockingly, most people, I don't know, well, pretty much anybody in the country that uses angle lighting while they're doing lasers. Something I do, I also do, actually, interestingly enough, I also check blood pressure when I do lasers too. Today's one of my patients, I discovered that he had high blood pressure. It's something interesting that sometimes, people don't really pay attention to. But during these procedures, you're under a little bit of stress. We also give you a little bit of medication, and it could raise your blood pressure a little bit. So it's important for us to kind of make sure that that's under control too when we're doing this. But all these things are all factors what we do to make sure that your skin is really, really safe as we're doing this, and I'm paying attention to different skin type and while we're doing this. Let's see here. Arisha is saying, can microneedling cause damage? Getting it done for scarring, but it's creating more pore-like micro holes. Well, it could actually sometimes, especially for ice pick scars, make the scars get wider, appear a little bit wider. It could turn it from a ice pick scar into a boxcar scar. Maybe a little bit more superficial, but that could end up happening. I don't really recommend microneedling for the vast majority of scars, to be honest with you. Let's see here. Melanie is saying, I have keloid-prone skin, so surgery may not be an option to correct my eye bags. The interesting thing is for the eye area, though, patients tend not to keloid as easily as other parts of the face. Part of it is due to friction and also just the way that somebody would potentially correct the eye bag. Usually they go through underneath your eye to be able to do that. So basically they'll lower the eyelid, retract it, and go inside. And so typically there's not much involved with a visible scar on the outside, just to be clear. But you could double check to see. I'm not sure if you need to remove excess amount of skin, but just so you know, having keloids doesn't mean that you can't do eye surgery. We have a lot of patients who have keloids. We do a lot with darker skin types, and a lot of them have had keloids in the past, and we've run into zero problems with that. Let's see, this question. I is saying, how many months to see that results? This was 6 months out, 6 months afterwards. Oh, hi, G. How's it going? Thanks so much for stopping on and saying amazing result. Appreciate you. I know I missed a few questions, so I'm going to hit back over here. Let's see here. Summary saying that the doctor may not do punch excision on the temples. Punch excision on the temples, you have to be careful with as well. I would be really, really careful in general with this concept. Honestly, be really careful with the physician you're going to for these treatments, especially invasive scar treatments. There's not just like a thing where, it's like a one size fits all. And it's also not something where somebody should just do something to experiment on patients. It's you really have to be very, very careful, very meticulous as you're doing these procedures. So just, pay attention to that so that you feel a lot safer with whoever you're going to. Let's see here. Lily's saying, is punch excision bad for the cheeks? Risk of not healing well. At some point, I'll showcase you why it may not heal well. Part of the reason why is basically that sometimes it's the scar is perpendicular to something called Langer's lines. And the way we could actually tell how it's going to heal sometimes is I have you smile, and patients who do treatments with me know I have you smile constantly. I'm constantly testing where the tension is, where the folds are. And so I'm looking and seeing where the scar is going to fold and how it's going to fold as it's healing. And so if there's too much tension on the scar, it could potentially make it worse as it's healing when you do an excision. So if you take out that scar and you do it in a spot where it's perpendicular to those lines, you may find that the scar gets a little bit wider. And that's where I end up having to fix a lot of times from somebody that's doing it in Texas a lot. He's doing a bunch of excisions and he's doing these perpendicular scars all the time. And I'm having to fix that. It's very, very difficult to fix, honestly, very, very tough. So just be aware of that, if you have a scar that's perpendicular, double check to make sure that your physician is really going to be comfortable when he excises that, because that's a higher risk one to do. And maybe they're okay. It's possible it's a location that's okay, but just double check that. Hardest thing, is subcision with filler the most effective for ice pick or boxcar scars? Not sure which one I have. So, ice pick scars, typically what I do is excisions or TCA Cross. If they're really basically bundled together, like the patient I had today, really deep, thick ice pick scars, really tightly packed, dense. In that case, what we have to do is we actually do excisions. We also use a fully ablative CO2 laser for that patient, and we have to do subcision as well. So it's very, very tightly bound. If it's a boxcar scar, a lot of times you do want to undermine it underneath there, help pop it up, and usually want to use a laser to soften out around the edges. And sometimes I do TCA Cross as well. Anan is saying, funny you say that when I had literally the best experience with microneedling after trying it all. Awesome, Anan. I'm happy that people try things and it's working for you. Obviously, microneedling is not particularly expensive. But that being said, I've tried microneedling myself. Patients that have done it, many patients have done microneedling like 20 times more than that, and it hardly did their scars, improved their scars. But if it's relatively superficial scars, maybe that's all you needed. I'm not sure. Relatively superficial, it's possible. Most people, though, it's not going to help enough, and you really are spending a lot of money. And sometimes certain kinds of scars, it can make it potentially worse. Let's see here. What is better for hypertrophic scar for the nose? So usually I do a steroid injection. Sometimes I'll do something where essentially what I would do is a laser, like fully ablative in some spots. And, essentially what I do with that is I do fully ablative in some spots, and then we use a silicone tape afterwards. Gabe is saying, why is subcision usually super expensive? It takes a lot of work and a lot of energy for me, honestly. I can't do as many of them a day. It's just a lot of effort, a lot of concentration. Even if it doesn't seem like it takes too long, sometimes it's still the fact that it didn't take too long is actually because I'm really, really good at it, if that makes sense. It's because I'm know exactly where I to go with it, and I focused on it, and I broke up the exact scars I need to without causing damage to surrounding tissue. And that really is, high level. They'll see a lot of people that are doing things, and it's going to be just broad strokes, and they're doing things where it's too aggressive for the area, wrong tools for the area. There's a lot involved with it. There's a lot of concentration with everything I'm doing, but subcision in particular, I've always been incredibly careful with it, and it's just that you start to see through all the complications that patients have been having and the different issues that they've been doing multiple times, subcision 3-6 times. With me, I'm very, very thorough that first time. If I need to do more, I'll be happy to do more, but I'm very, very thorough with it. I'm extremely thorough with it. So it's I am very comfortable doing it, and I make sure that afterwards we solve your volume. Like this patient, for example, we broke up his scar tissue very, very well, and then afterwards we did some Bellafill for him. That's what ended up helping out with him for his volume loss. So, and then he's going to need a little bit more Bellafill, but he doesn't have actually tethered bonds anymore. It's done. I went in there with a cannula or anything like that, and it's just clear. Let's see. Gabe is saying, I thought people only need one subcision. Yes, with me, they do. I'm very thorough with it. And that's, less than probably a handful of patients if I need to do more than more than once, I should say. Definitely not even more than twice ever, because I'm just thorough with it. And so it's certain areas, I think in the jowl area, sometimes you may have to do it a couple times, sometimes because you don't want to go as aggressive in that area. Sometimes, very, very rarely if you really have to. But it's not a thing where you just do it over and over and over again. It's an invasive procedure. There's a lot involved with the patient too, just a lot of swelling. You don't want to have to put people through that multiple times. Just do it really effectively that first time. And, I'm a big believer in one shot, one opportunity type of thing. And just you have one shot, one opportunity to go in there, break up that scar tissue. I'm going to try to make sure I maximize there for patients. Kaylin is saying, hi, any recommendations for TCA Cross or scar treatment in New York, please? I actually have a lot of patients from New York who come in from New York. I haven't heard anybody who's been able to achieve excellent results over and over, honestly. I haven't really been able to find that. Kamikaze is saying, what's the pricing? So most patients for their scar treatments, they spend about $5,000 to $7,000 for their scar treatments, vast majority of patients. Let's see here. Melody is asking where we're located. We're in Newport Beach, California, just a few minutes away from the airport there. MD Dermatologist is on here is saying, which procedures are go-to procedures in single session? Well, a few different things were done over here. What we did with this patient for his ice pick scars was TCA Cross. He has rolling scars, so we did subcision. And then he also had a bit of hypertrophy around the scars. So it's atrophic scars and a bit of a hypertrophy. And so in those cases, what I did was ablative CO2 laser for that. And then I also did a fractionated blend of lasers as well. And, that's essentially what I ended up having to do. If you're interested in kind of learning more, I can't do any trainings more this year. I did a bunch this year, but next year, hopefully there'll be a couple of slots that I could do some training. So feel free to reach out. Since you're a dermatologist, I'll be happy to help you out with that though at some point. I'm happy to have people showcase this, these methods for safety. I want everybody to do this really, really well and do it at a really, really high level. So hopefully that'll help you out there. Let's see here. Where are we at? Is Morpheus good for scars? Not so much. No, not really. It may help a little bit with rolling scars if you do it with subcision. But other than that, I wouldn't really recommend it really for vast majority of scars. Sam is saying, when you do a punch biopsy on the cheeks and temples, how long does it take for the skin to go back? Well, usually just a couple weeks, honestly. You start seeing it get softer just after a few weeks. One of my patients today that I followed up with, she's of African descent, and we did wide excisions on her, elliptical excision. We did wide punch biopsies, excisions as well. And her skin looks amazing about 4 weeks out now already. Really, really great result already. It's going to get better and better. I think she may end up letting us share. So when she comes in a few months, she comes all the way from Atlanta. But when she comes back in a few months, hopefully we'll be able to share her results as well, which would be really nice. Really great improvement, actually, in a darker skin patient there. Let's see your thoughts on Photona fractional laser for rolling scars. Photona is a good brand. I think it's probably good. I was actually looking at them myself too at some point because I like their little erbium handpiece. I may eventually get one of those. But otherwise, I'm not sure. About the rest of the platform, I'm not super familiar with it, but from what I've heard from other physicians, it's a good brand, good company, so you can consider using that. It's not so much about the brands, though, to be honest with you. For like patient purposes, it's more for my purposes, to be honest with you. I just want things that are consistent, the device doesn't break down, things like that. Like I have like a Cyton Jewel, which it doesn't break down, it's awesome. But some other devices, it's like some of the engineering is not the best, let me just put it that way. And it's like kind of questionable what they ended up doing with the way it's like super cumbersome, the way that they had it. So it's not so much for patients, to be honest with you. It's more from us, like who you're going to, like how comfortable they are with the device. That's what matters more than the device itself, to be totally honest. I know people call sometimes and say, do we have this device? Yeah, chances are we have the device, but it's not about the device. I will choose a device for you. We'll say like, this is the best possible device for you. There's a way we could do it properly. But I wouldn't say that as a patient, you should be searching people because you see me using a particular device. That means you should be going towards a person that goes and uses that device. It's possible to use a different device and they're comfortable with that device. I would just say that, depends on your practitioner. See the results, see what they're putting out there. Let's see, if you had to choose Halo or Fraxel laser. Cheap question. It sounds almost like from one of the reps are trying to get me on this one. I did get a couple calls sometimes, actually, by the way. I don't know if any of you guys, sometimes I get text messages or calls from reps about these things. And I'll say, I'm going to be honest and clear with things about this stuff. Like, I don't find that Halo or Fraxel helps much with scars. That's the truth. That's the honest truth. I did 6 Fraxel lasers on my own face for scars, and my scars, at the time, I thought my scars were severe. I thought it was really terrible. Turns out it wasn't that severe. Actually, I started seeing more patients. When I realized in this world that people have very, very severe scars. But at my time, I thought it was very, very severe. Anyways, the Fraxel laser, and I did microneedling, it had very, very minimal to my scars. I don't think any improvement really. My face was just like it was almost like I was on asphalt. Like someone just put my face on asphalt because at some point, initially it wasn't super aggressive. And then the guy was like, he's like, let me go amp it up some more. And he kept amping it up each session. And it was like, oh, okay, now I'm going to get better and better results, and it didn't turn out to be great results actually. So I don't push it, and that's why I never talk about it too much. It's like, it's not really too helpful. I think it's okay for pigmentation probably, but it's not something I would be telling patients to do for their scars. And I think that really needs to be pushed aside now at this point. I think that obviously there's different forms of Fraxel, but it's not going to be doing what this could do. This is fully ablative CO2 in select areas and fraction to blend elsewhere. And the Fraxel laser by itself, even if you did it like 20 times, is not going to be able to give you this kind of result, not at all. And so again, I'm going to show you this one because we have a bunch of people that are coming on because people are asking what kind of scars. I'll show you guys a little bit about the kind of scars right here, and you can see this a little bit closer here. So take a look at this, and you can see he has ice pick scars, he has boxcar scars, he has rolling scars. So those are different kinds of scar types he had. So if you want to learn more about that, I'll be happy to go through it, but those are kinds of scars. He's of East Asian descent over here. What about nose scars? Actually, I've done a lot with rhinoplasty scars. A lot of people on this area do rhinoplasty, so super comfortable, it's actually very, very satisfying for the vast majority of scars. Sometimes, though, it depends on how deep they went with the scar. I hope, they didn't completely cut things down too much or didn't get too much of an infection afterwards. But the vast majority of scars, we are able to improve on the nose. The reason why I'm saying that it depends sometimes on the way surgeons do it, it's because the nose sometimes doesn't heal as easily as the rest of the face. It takes a little bit longer. It takes more sessions sometimes. There's more patients involved on the nose compared to the rest of the face. Just FYI. Let's see here. Period is saying, could high processed foods affect acne? I think absolutely it could. I think it definitely, I have no question actually in my mind that food plays a big role. When I was younger, when I was suffering from acne, I really, really wish that people told me that there was a link with diet. And I went to multiple dermatologists and they kept on telling me that there was no link. There is no study. They kept on saying, these are the words that they said. There's no evidence that food is linked with acne. They said it was just a genetic thing. There's nothing you could really do. And I drank so much milk. I was drinking like 3 or 4 every day, and it was not the right kind of milk. It wasn't like the A2 protein milk. It was just like regular milk, dairy milk. And I'm just, I drank 4 of those. And I was like on the wrestling team, and I was like drinking like whey protein. And I was like, my face was like on a dirty mat, and for hours, and with a bunch of teenage kids. And so it was like disgusting when you actually think about it. I was like, did my diet play a role? They're like, no. Is the fact that I'm on the wrestling team going to play a role? No. That's the thing. And I was like, no, it's not because of that. And it's just your genetics. And I wish someone was like, maybe like your diet does play a role. Maybe like the wrestling isn't the best thing. Maybe like rolling around like a dirty, disgusting mat, like really with a bunch of teenage guys is like not the best. And if you care about your skin, which I did, it was like really, really important for me. I would have actually stopped the milk, and I would have stopped wrestling. I would have done it. I would have done it for my skin, because I was like really, really upset about the fact that I had really bad, at least in my mind, I had really bad cystic acne, really, really very, very oily skin. And so now I think a lot of people are aware of this, the link with diet, and a lot more people talk about it. But it's been a long journey, and so you'll hear people say. To this day, though, if you ask them about certain food, things like that, they'll say, well, there's no evidence of that. And so you kind of continue, but they'll claim to continue doing that food. And that's, to me, a red flag, because it's like, maybe there's no evidence because it just costs a lot of money to make these studies. And that's why there's no evidence for it. It's not because there's actually, it's not that it doesn't actually have a proof or evidence, but anecdotally, a lot of people found that there's certain triggers for their acne, but they just didn't make a study for it. So just sort of, pay attention to yourself, put your own health first, and realize that sometimes the data is going to lag. Sometimes science is going to lag. Sailor Moon saying, my derm had told me the same thing, no link. Yes, absolutely. It's sad, actually, right? It's just sad that that's the case. That like so many people said that in a certain generation, at least my generation, that's the case. Miriam is saying, is there a way to make my lips longer instead of fuller? Yeah, what I do is I essentially just basically pull up the lip, but there's still going to be a little bit of fullness with that. But essentially, we'll try to pull it up. I usually don't do too much in the vermilion border then. I'll just try to pull it up with these pillars that we'll do. So yeah, I would absolutely help with that. Kay saying, wait, what causes deep pore scars on sides of the cheek? I'm a 23-year-old woman with dry skin. Usually it's some sort of acne. Usually the vast majority of patients is acne. Let's see here. Dopit's Ruby is saying, what about cystic acne? Well, that's what I was referring to with diet. Could potentially play a role. Of course, hormonal changes could also play a role. All those things can end up being factors for it. Leslie saying, how long after a cure do you start treating scars? So actually, some of my patients last week were about 3 months out after a cure. Usually 3 to 6 months is typically what I wait after we do the cure laser. It's working incredibly well. We basically have it so that once the acne is under control, we want to make sure it still stays under control. Oil production is under control, and then we'll go ahead and tackle your skin with a laser or in this kind of combination session for the scars. Jesus is Lord is saying, what do you think of Rogaine? Any side effect? What happens when you stop using? Not so much of side effect, honestly. I don't think that there's any real evidence of a particular side effect with a topical Rogaine, topical minoxidil, other than if it's on your hands, you want to avoid touching newborn babies or pregnant women. But otherwise, there's not really going to be much side effect. The only thing is that it slows down the hair follicles from essentially. Let me start over. It essentially helps prevent more hair loss. Sometimes it doesn't have actually enough of an effect for hair growth. So you may need to do other things. Sometimes oral medications like finasteride or oral minoxidil can help more with that. And then of course we do a lot with PRP injections. That helps a ton, especially it helps for patients who get clumps of hair, in the shower. Then you just notice that there's a lot of hair loss there. So that's something like, PRP injections could potentially help quite a bit there. Gabriella is saying, how do you feel about lasers and scars? I love it. I do it all day long. I do multiple times a day, but not just lasers. That's the thing. The point is it's a few different things. I know I'm over actually. I love the questions. So I'll hit some of these questions tomorrow just so you guys know. If I missed yours today, I'll try to go to it tomorrow. I'll try to, if there's something pressing you wanted me to answer, I'll try to go back to this now. If you had something really, really fast, I'll try to hit it right now. Anybody, I appreciate all the questions though. I'm trying to hit some of the ones that I missed here, but just try to know and help with this. It'll help a little bit. It's not going to help quite enough though, with this kind of, it'll help a little bit with collagen production, but these are deep scars. These are thick scars also. They're ice pick scars, rolling scars. We had to break up that scar tissue, and that's what we ended up doing for this patient. All right, guys, thank you so much. I will see you again tomorrow. I know I missed a bunch of questions, but I'll hit you again tomorrow. So if you felt like I missed it, I'll be happy to help you tomorrow. So I'm on for this whole week, Monday through Thursday at 9 p.m. And I come here at 9 p.m. I usually try to come on exactly 9, unless my computer is delayed just a little bit there. But